Hello, I'm Professor Ian Gwilt, Professor of Design at the University of South Australia.
And I'm Dr. Aaron Davis, a Research Fellow also at the University of South Australia.
And we're here to briefly introduce the Whole Mouth Health Project, a project we've been working on with partners in the UK, Switzerland, Nigeria and Chile. The Whole Mouth Health Project has been running since the start of 2020 and is focused on oral health literacy and whole mouth health. One of the critical aspects of this project has been the use of co-design methodology to work with a wide range of partners and co-researchers in a way that allows us to collaboratively explore the concept of whole mouth health. Our original intention was to run a series of face-to-face co-design workshops in each of the partner locations and then to meet together to discuss the outcomes from these workshops. But having met together in Sheffield in the UK in February 2020 to plan the project, it became obvious that we were not going to be able to bring people together in the same physical space to take part in our workshops. We didn't want to just switch to online workshops, so instead we developed a workbook that could be shared with our participants. The workbook was designed to be posted out to the participants, completed, and then returned for analysis. The data collected from the participants in this first workbook was then used to inform the development of the next stage of the project. You can learn more about these workbooks and our approach in 2 webinars that are available on the FDI website. You'll also get to meet a few others from the research team. But before you go exploring the webinars, we'd like to introduce you to a digital version of some of the activities you'll see in the workbooks. We've been developing these in tandem as a way of including more people in the research process. Although we're still developing ideas for how to connect people with this platform, one way we're thinking about is to try to get people to use the time that they spend in a dental waiting room to take part in this research. So now I'll hand over to Aaron to introduce some of these activities to you.
Thanks, Ian. So as you can see, we've started looking at how people get from a QR code through to the project homepage. Once they arrive at this homepage, they can scroll through the activities or continue scrolling to find out a little more about the project and why whole mouth health is important. Coming to our first activity now, the fun facts. In this activity, we're asking people to think about a series of interesting facts that we have collected across the whole mouth health project. We ask people to rate these facts as maybe things they think are boring, perhaps they're interesting, or they just want to say, I love it. Once they've been through a series of these facts, we then present people with the full list of fun facts and ask them to pick just one that they think everybody should really know. Finally, we ask for a little bit of feedback about the experience of completing the activity and then ask people if they're happy for their data to be added into the project or if they would prefer that it was deleted. Our next activity is about rediscovering memories associated with the dentist, teeth or mouth health. We ask people to look at a list and select up to 5 of their strongest or most important memories. Once people have had a look through and selected these, we then drill down to collect a little more information about each of them. So we ask people to tell us how old they were at the time, whether they remember it being a positive, negative, or perhaps just a neutral experience, and then we provide an opportunity for people to tell us a little bit more about the story of this memory. Now we'll speed this up so that we can get into the end sequence, but we ask this for each of the memories that are selected. And then in our last part of the activity, we do ask people to think about, for someone that was born today, whether the experience would be better, worse, or about the same. The end sequence asks for feedback again, permission to store the data, and then directs people back to the homepage. Lifelong behaviours is about looking at how people's behaviours might change over their lifetime. This activity begins by customising for people's current life stage and then using a process of elimination to identify a few behaviours that people have done for some but not all of their life. So once people have identified these, we choose a couple and look in a bit more detail. So we ask people what age they were when they were doing this behaviour, as opposed to not doing this behaviour, and then ask people to identify the things that might have made them start this behaviour or the things that might have made them stop this behaviour. So we do this for each of the behaviours that people have identified, before then asking people to give one piece of advice to their younger self and to identify what age they think they should have been when they were hearing this advice. The end sequence asks for feedback and permission to store the data before directing back to the home page. We've also developed 3 quiz-based activities that are based on the relationship between mouth health and various organs, elements of your outer appearance, and bodily systems. We ask people to reflect on whether they think each element is related to their mouth health. So people can choose to complete a short or a long quiz and are then presented with a series of questions. Once people have answered, we show them what everyone else who's completed the quiz so far has said, before revealing what our group of dental experts thought. Finally, we do ask people if they thought that the expert opinion was something that was obvious, whether it was interesting or perhaps surprising. The closing sequence is then the same as in the other activities, collecting some feedback and then permission to store people's responses and their results. We then direct people back to the project homepage. We're really hoping that we'll be able to use the feedback we get from our early participants to develop some fresh new versions of all of the activities we've run through today, and perhaps some new ones as well. We're hoping these might be ready by the time people are due for their next checkup, but for now I'll hand you back to Ian for a few closing remarks.
Thanks, Aaron, that was great. So just to recap, these activities are not the end product of this project, and we will be continuing to co-design the development of these materials and resources. We're currently rolling out Workbook 2 and this beta version of our digital activities, and we'll be using the feedback we collect from the participants to help us deliver an updated version in the next stage of the project. If you find this project interesting and would like to get involved, please get in touch with Rachel England from the FDI. Thank you very much for your attention, and we look forward to continuing to build whole mouth health literacy together. Bye for now.